Welcome back to the Doc and Diana Show. I'm Dr. Chad Edwards, and I'm going to continue on my discussion about cardiovascular disease. So I left a little bit of a cliffhanger last time on the number one cause of cardiovascular disease. And that number one cause is hypertension. High blood pressure is incredibly common, and it is the number one contributor to cardiovascular disease. So what is hypertension? It's very common, first of all. Secondly, we have this entity that I was in my traditional medical training, not the way we practice, at Tulsa Functional Medicine at revolutionhealth.org, but in my traditional training, we had this entity that we called essential hypertension. And what that is hypertension that we can't attribute to something else, or what we would call secondary hypertension. Secondary hypertension is, for example, you have a tumor of the adrenal gland called a pheochromocytoma that causes you to kick out all these catecholamines or like epinephrine, norepinephrine, those kinds of things that make your blood pressure go up. So that we can identify that you got a problem, and because of that problem, it's causing hypertension. And there's a whole host of things that will cause secondary hypertension. The way you fix that kind of hypertension is you fix that primary cause. Whatever that cause is, you fix that, the hypertension should improve. However, in essential hypertension, you have high blood pressure that, the way I was trained, we don't know what causes it. I hate the term essential hypertension because if it's so essential, then why are we trying to get rid of it? It sounded ridiculous to me. And the sad thing is, it's not one of those things that we don't know what causes it. We actually know exactly what causes it. And there are actually 400 known risk factors or contributors, what we call the infinite insults, because there's just so many of them. We know 400 of them. But all of these things will contribute to disease of the cardiovascular system. And in this case, hypertension. So there's a lot that goes into how your body responds, but basically these 400 different insults will start attacking the body. The body has to do something to try to defend itself, so to speak. And so it will respond in one of three different ways. And these are what we call the three finite responses. The three finite responses are inflammation, oxidation, or oxidative stress, and vascular immune dysfunction. So if your body sees one of these, it's going to mount one of those three responses. Now, interestingly, each of those three responses also contribute to the other two. So then you have these multiple different ways that your body is responding to these insults, that your body's trying to get all that stuff under control. And it's initially a correct response. It's like if you have an infection, your body comes in and mounts an inflammatory response trying to kill the bacteria. But if that response just continues and continues and continues, that's not a good thing. Now you have this chronic inflammation that's not good. But you need to have that acute inflammation. In the cardiovascular system, you're responding to things that may or may not be a bacterial infection. There may be a number of other things that are contributing to that, and your body's trying to fight it. So you have these three finite responses, and because of that, your body then will develop what's called endothelial dysfunction and vascular smooth muscle dysfunction. That results in remodeling of the vascular system, specifically the smaller, what we call the oscillatory and resistance arterioles, and we can measure the health of those in the clinic at Revolution Health. It's not a common test. Most doctors don't have the machinery needed. We do have that machinery in our clinic. Specifically, it's the CV profiler, or what's called CAPLA. It stands for Computerized Arterial Pulse Wave Analysis. And that machine can actually determine the stiffness in those arteries. And that is a reflection of the endothelial function or dysfunction and the vascular smooth muscle dysfunction. And when we identify those problems, we can actually treat that and work on that. So when you hear someone say, I've got essential hypertension, number one, it's not essential. Number two, it's a big problem. And number three, we know what causes it. And number four, we can actually do something about it besides just give you a blood pressure medication. There are blood pressure medicines that are good and healthy for the blood vessel, and they block those responses, those three finite responses. They will block components or steps in that response to try and lower blood pressure, but they also improve the health of the blood vessel. However, there are a lot of blood pressure medications that are not good for the blood vessel, and they should not be used for essential hypertension. Unfortunately, most of our doctors are unaware of the good versus the bad ones. And this is one of the things that I lecture on, trying to educate doctors about what the literature shows about the physiology and how they work for high blood pressure and trying to lower it. So I'm going to have some more videos on medications that you should take for blood pressure if your blood pressure is too high. And I'll have some other videos on what you should not take for blood pressure. And then I'm going to show you as well in some other videos coming up what should you do for nutrition? What should you do for exercise? What about stress reduction and lifestyle, nutritional supplements, all kinds of things on how you can both treat the blood vessel to make it healthier, which will ultimately lower your risk of cardiovascular disease and strokes. So more videos to follow. So be sure that you like these videos. Subscribe to the Doc and Diana Show. Check out revolutionhealth.org. Give our clinic a call at 918-935-3636 to schedule your cardiovascular evaluation. There is a lot of testing that we can do to identify cardiovascular disease much earlier than when we look at just those 5 traditional risk factors we talked about in our last video. So if you didn't see that one, go back and take a look at that one. And follow and share these videos so that we can get the word out about what it is that we do at Revolution Health and in our Tulsa Functional Medicine Clinic that can improve your health and lower your risk of cardiovascular disease and improve your blood pressure in a good way.